Hello and welcome to this brief summary of our recent study on the effectiveness of smoking cessation treatments in the real world. There are two major forms of smoking cessation treatment: behavioral support and medication. The evidence for their effectiveness is provided by multiple randomized controlled trials. Such trials have a high internal validity, but because they are conducted under very strict conditions, they do not reflect the real world in which these treatments are supposed to be used. Therefore, the aim of the current study was to estimate the real-world effectiveness of commonly used smoking cessation treatments. We conducted a study in a large random sample of 1,560 smokers from the general English population. Subjects were included in our study when they were smoking tobacco during the interview at the start of the study, responded to a postal questionnaire 6 months later, and made at least one serious attempt to quit smoking in between these two time points. At 6 months, we asked if subjects were a non-smoker and which of the following 4 methods they had used during their quit attempt: medication on prescription in combination with specialist behavioral support, medication on prescription in combination with brief advice, nicotine replacement therapy bought over the counter but without behavioral support, or none of these. Medication on prescription included nicotine replacement therapy, varenicline or bupropion. Specialist behavioral support referred to one-to-one or group behavioral support by a National Health Service stop smoking service. Brief advice referred to advice delivered by the prescribing healthcare professional. In our analysis, we assessed the association between method used during the quit attempt and whether or not subjects were non-smokers at 6-month follow-up. It is important to adjust such an analysis for confounders. These are variables which are associated with choice of method on the one hand, and which have an effect on the outcome, smoking status. For example, it has been shown that smokers who decide to use medication are more tobacco dependent and have more difficulties quitting than smokers who try to quit unaided. We measured dependence and a range of other potential confounding variables during the baseline interview to adjust our main analysis. And here are our main findings. Only about 5% of smokers had used medication on prescription combined with specialist behavioral support. 21% used medication on prescription combined with brief advice. 30% used nicotine replacement therapy bought over the counter, and 45% used none of the above. Now, compared with smokers using none of these cessation aids, the chance of being a non-smoker at follow-up were 2.58 times higher in uses of prescription medication in combination with specialist behavioral support, and 1.55 times higher in uses of prescription medication with brief advice. The use of nicotine replacement therapy bought over the counter, however, was associated with a lower chance of being a non-smoker. We conclude from our study that, in the real world, a combination of specialist behavioral support plus medication on prescription is the most successful method of becoming a non-smoker. Medication on prescription plus brief advice is also effective. Thus, more smokers should be guided into these forms of treatment. Nicotine replacement therapy bought over the counter may be associated with a reduced success rate. I would like to thank the collaborators on this paper and you for listening.
We hope you found this presentation from the content of Mayo Clinic Proceedings valuable. Our journal's mission is to promote the best interests of patients by advancing the knowledge and professionalism of the physician community. If you are interested in more information about us, our homepage is www.mayoclinicproceedings.org. There you will find access information for our social media content, such as additional videos on our YouTube channel or journal updates on Facebook. You can also follow us on Twitter. More information about healthcare at Mayo Clinic is available at www.mayoclinic.com. This video content is copyrighted by Mayo Foundation for Medical Education and Research.